Hello, this is Dr. Eldred Taylor, and I'm here with one of our speakers who will be at our annual American Functional Medicine Association conference at the Georgia World Congress Center in Atlanta, Georgia, November the 10th through the 12th, 2016. And today we have Dr. Dennis Harper. He is an instrumental leader in the state of Idaho's chiropractic profession. He has molded the laws, standards, and policies in his region and continues to contribute to the advancement of healthcare on a national level. Embracing his practice of more than 35 years, Dr. Harper has treated more than 19,000 patients. Implementing his proprietary restoration treatment, he has performed more than 20,000 ozone vitamin injection treatments in the last 6 years. And in November, Dr. Harper will be speaking on the topic integrating ozone therapy into your practice. Dr. Harper, how are you doing? Uh,
I am
and
phenomenal.
well, great. Well, great. And I would like for you to just give us a synopsis of what we can expect to hear when our attendees attend the meeting in November.
Well, one, I want to thank you very much for the opportunity to speak, and I am real excited to speak in front of the group. We have been working for the last basically almost 10 years researching ways to integrate ozone into joint regeneration, into autoimmune disease treatments, into your practice so it's effective, efficient, and reproducible. One of the things we found with doctors is that they know a lot of things, but they have problems putting it into a working basis. So we try to get people and doctors to understand hands-on, touching their patients, talking to their patients, and then systems that work for their patients to not only relieve pain, but to improve function, restore joint function, restore the body's ability to heal itself. And what we do is we take ozone and the vitamin mixtures we've used in a way to proliferate regrowth of cells. In other words, we'll take a knee joint and we use an advanced method of producing cytokines and thrombocytes by drawing blood out, putting in a clot, mixing it with vitamins that we mix, and then taking ozone and ozonating the system. So when we put it in the joint, we get accelerated healing in the joint areas. And we've taken it one step further. We've actually added stem cells into the system. We use mesenchymal stem cells from cord embryonic tissue. And so we're now incorporating that into healing, which has accelerated our healing by numerous times more than anything we've seen before. So we have a system of taking the person from a degenerative joint to a healthy joint, or a degenerative system to a healthy system. We're seeing results with every type of autoimmune disease out there with this, from anything you want to put a list on, from the C word out to COPD, to chronic inflammatory arthritis and neurological disorders. So we're seeing a lot of changes with everything with this combination we're using.
So, when you were describing it, that's what I was thinking is that it sounded like stem cells. So, I mean, so the combination
Well, one thing,
therapy is that.
combination is
Mhm.
over the top. Because what you do is ozone actually will stimulate cytokines in the body. So it'll stimulate your own body's stem cells. And then when you take the clot matrix, we draw blood out, we clot it instead of spinning it down similar to PRP. And we get a higher capture rate of cytokines and thrombocytes than PRP does by 20 to 30%. So we put it in a clot matrix, inject it into a knee, and instead of a 24-hour activation level that PRP has, we had a 14-day activation level of your own body's system. Plus, we add the stem cells to it, and now we have literally a factory for producing healthy cells. So now it's just stimulated this huge factory of producing and multiplying over and over again. And then we oxygenate it with the ozone, and now we have oxygen. We put minerals in it, put amino acids with it. We put stem cells. We have a clot matrix, and now we've got built a factory for the body to start really regenerating back to what it should be.
So, again, one of the goals of the American Functional Medicine Association is, like you said, is that doctors know a lot of things, but actually putting them into practice. And we know that they'll help patients, but sometimes it's difficult to put it into practice. How hard is it to learn this technique?
We have a 2-day training course we do, 2.5 days, that gets them the basics. Depending on the level of expertise they have, if someone's done a lot of injections, we can take them for a day and get them up to speed.
Okay.
And so that can work really, really easily for them. And we have a lot of doctors that do Ozone now, and we convert them over to these systems, and it's generally a day to day and a half. Someone that's brand new, that's never touched the needle
Right.
much, it's a little bit more of a challenge. And we tell them to come back a couple of times. And one thing we've done is we're continually modifying the techniques to make them the most efficient out there and the best out there. So we've made it where we support our doctors even after the class. And we have 150 offices now we work with. And we constantly are upgrading the techniques we use, the procedures we use, the protocols we use, everything to informed consents, to training your office staff, to training your MAs. We make it a very in-depth program for these doctors if they're willing to do that. We even go to doctors' offices and spend a day with them. I got 3 doctors I'm lined up next month to spend a day with each one of them. And they have big practices. They want to do it well, and they're taking it serious. And I tell doctors it's something to take serious. It's not something to do one here or there. You take it on and you do it well. And we like to see doctors really do the techniques well. And so I kind of quiz them. I said, what do you want to do with this? Do you want to take this seriously? What conditions do you want to treat, and how serious are you treating these conditions? And then we literally do whatever support that we can do to help that doctor be successful at doing that.
Great. That really sounds interesting, and I'm sure a lot of our attendees would be interested in learning the technique. So, well, Dr. Harper, thanks so much for giving us a little synopsis of what you do. It seems uh, like it's very helpful. The combination therapy, I'm sure, it's greater than the sum of its parts, and this sounds like something that could really be helpful to a lot of people. So hopefully the American Functional Medicine Association will be a platform to let more people know about this interesting treatment. So again, thank
We're
you
looking
for,
forward.
go ahead, I'm
Thank
sorry.
you. We're looking forward to speaking, so I want to thank you very much for your time.
Well, great. Well, thank you. So, to hear Dr. Harper, please register as soon as possible. The early bird ends in September, in the middle of September. So, make sure you go to the website, www.afmassociation.com, and register to attend our annual American Functional Medicine Association conference, November the 10th through the 12th in Atlanta, Georgia. Again, Dr. Harper, thank you for your time, and we look forward to seeing you in November.
Thank you very much.